This is the Sisterhood Society podcast, where three sisters talk life, food, fashion, kids, and everything in between. Become part of our sisterhood where everyone is welcome at our table.
Welcome back to the Sisterhood Society podcast. Today, Kait is off, so it's just going to be me and Whit doing a little update since my surgery. So there's been lots of questions around what I had done, why I had it done, all of those kind of things. So we thought we would just spend this time kind of talking through maybe the taboos of plastic surgery and also just the surgery as a whole.
The ins and outs.
Yeah.
Okay.
So we will start with what's good in the sisterhood.
Well, what's good is that I'm not recovering from a surgery. I just got back from Nashville. We spent the weekend in Nashville. Since Tara was out for surgery, I went down there to shoot stuff on Kait so we could get ahead with our photo shooting. And since it was Rivy's birthday, my oldest birthday on Saturday, we decided to take the whole fam down there. And he got to go to a Titans preseason game, which was the highlight of his year because Phil went with them. And Phil is his idol. So Kait's husband, Phil. And so he was just really excited the whole weekend, and he got his Xbox that he was wanting, and it was just an all around great weekend.
I'm glad you guys got a chance to get away.
Yeah, it was fun. What's your good?
Well, my good is that Mom is in town and she's been a huge help.
You've been eating some amazing toast.
I've had no appetite, so I've been eating lots of toast. But she's prepping some meals out for us. She's helping Brian take care of the kids. She's just basically taking the pressure off me to be able to
This house
rest
is
and heal.
clean and organized.
Yes, she has helped clean up the basement as far as all the Royal and Reese stuff. A lot of the things that we brought back from the office that we hadn't had a chance to really figure out what to do with. And her goal is that I'll be able to park back in the garage by the end of the week.
You probably already could.
I think we could definitely get
pretty
it down.
organized.
So before we jump into the topic, we do have a sponsor for this podcast. Our favorite, or Whit's favorite company for pre-workout is called Just Ingredients. We mentioned them 2 weeks ago on the podcast.
So I am obsessed with their pre-workout. It is delish, but it's all whole foods and organic, and she just makes everything with top-notch quality. So I feel like I can trust it instead of being like, I have no idea what's in this and I don't know how it's going to affect my body. And she does a really good job with just putting out the best quality stuff. I've used their facial serum. It's amazing. Smells awesome. She also has deodorants, like clean deodorants. She's also known for her protein powders. I know protein powders can be absolutely disgusting. Hers are so good.
And I was just looking, they are coming out with pumpkin spice protein.
Yes, that one it's only a seasonal item and it sells out so fast. So if you are a pumpkin spice junkie, I would highly advise grabbing that. But she spent a really, really long time developing her vanilla protein powder, because vanilla in and of itself, like the flavor, it's like made with a ton of junk in it. And so she's like, that's not going to work for me. So she like spent tons of time developing the vanilla flavor of protein powder, making sure it was all amazing ingredients. And yeah, I just love them. Everything they come out with, I'm like, that's delish. So yeah, go use our code if you want to tap into the Just Ingredient world. Our code is Royal, and that gets you 10%.
It's 10% off. Yes.
I believe. Yeah, 10% off at checkout, and it's phenomenal.
Okay. Once I start working out again, I definitely want to try it. I have
So
a couple
yum.
weeks before I can do that again. So anyway, the topic today, we want to just talk about plastic surgery as a whole. I was going to talk through my experience with my tummy tuck, but just kind of like, I feel like there is a little bit of that plastic surgery can still kind of be a taboo topic.
Mm-hmm.
And I had someone say to me, I wish I had medical reasons to be able to get a tummy tuck. And it just got us talking that I feel like it needs to be, one, more normalized, and two, talked about more, because I feel like nobody ever talks about the stuff that they have done, whether that's their privacy, they're more than welcome to do that. But I also feel like there is a piece of me that felt like I had to explain myself as to why I was getting it done. from like the diastasis point and like my belly button, more so than just from a standpoint of wanting to feel comfortable in my own skin. And I was like, why is that? Like, because the reality is that if you have the means and you also want to do something for yourself, like in my head, I was thinking, I've literally spent the last 8 years being pregnant or having children, or trying to get pregnant. And this is the one thing that I have wanted to be able to do for myself since being done having kids, because you do sacrifice a lot of yourself and your body for your children, which I had no issues doing, but I did want to be able to get my body back.
Yeah.
And
You had mentioned the other day, you're like, why is it that we women feel like we have to lay down and die after we have children and be like, oh, my children just messed up my body and I'm okay with it. Like, this is what I have to live with now. And I was like, you know what? That's a really good point, because me too, like I have had 3 C-sections. I've got like that little curtain, and I'm always like kind of trying to cover it up. And in my mind, I was like, okay, well, this is just my body now. But you're like, no, you can fix it if you want. You know, if you've got the means and it's something you've been really wanting to do and it bothers you, and it is kind of like something you're always aware of, like, then why not? Change it if you want.
Yes. So I went in last Thursday and I had a tummy tuck. I had gotten a consultation back in February. It'd been something I've been thinking about for a while. I could tell after Britain for sure that I had gotten some diastasis. And when I was working out, doing a plank or a, like a sit up position, there was a bulge for sure. It was almost like my, muscles were tenting. And so I knew something wasn't quite right. And no matter.
Our mom is in the background telling you, giving you pointers on what you're supposed to be talking about.
And so, so diastasis, if you're not familiar with it, essentially just means that your abdominal muscles do not essentially come back together after the baby's born. There's a separation period on purpose so that your body can expand to get ready for the baby. But afterwards, there's usually like a 12-month period of time that they will go back together. And sometimes they just don't. And so mine were definitely separated, especially around my belly button. There was like a 3-finger separation. And so it was something I knew wasn't holding my stomach in as tight as it normally would have before. And then in addition to that, I knew that I had some type of hernia around my belly button because it was laying flat instead of an any belly button like it had before. And so there was just a couple things from a look standpoint that bothered me. In addition to that, then because of the C-section, I could also tell as I was starting to lose weight, that the skin was sagging over my C-section line and wasn't retracting, like you would hope it would. So multiple reasons why I wanted to have it done, but mainly from a vanity standpoint. I wanted to just be able to put on a pair of pants and not have the, pants not fit in the waist because I have this bulge there.
Honestly, I feel like it goes even deeper than that. Like, not just vanity. It's just like something you're always aware of, something that maybe you're not comfortable with, that you have maybe anxiety over, like not
it definitely
being able
affected
to wear certain things.
I was gonna say it definitely affected what I would want to wear. I like wearing clothes that are more fitted. I'm not necessarily an oversized type of gal when it comes to the clothing that I want to wear. I've always worn more fitted tops, and I was shying away from that because I felt like everything was hanging on my stomach and looking. And it's something that other people probably didn't notice or to make aware of, but it was something that I always took aware of. Was aware of. And I didn't love that when I would zip my jeans that I would have a bulge below the belt line and then also above the belt line. And some of that was for sure weight gain, but also some of it was from the C-section as well. So I had gotten my consultation back in February, and I had scheduled it for August on purpose because I couldn't be in the pool this summer if I wanted to do it this summer. And so I purposely scheduled it after all the kids' birthdays because I knew that was going to be crazy. And then after they went back to school, so that would be a little less nuts of trying to coordinate if we had 2 of them, back in full day. So I went in last Thursday for it. We had to be there at 6 a.m. It honestly, the team of people was amazing. The thing that I was telling my cousin about it afterwards, and I was saying the one thing that I really appreciated about everybody that was, helping me is everyone was extremely specific about what was going to happen and what they were going to do. From the doctor coming in and telling me like all the steps, to the anesthesiologist telling me like what he was going to do and why, to the nurses giving me all the step-by-step instructions. Cause there was never a piece of me that was laying there like, what's happening next? Everybody was super specific, and I really appreciated that. And it took the nerves out of it. I also want to thank everybody, because I got probably close to 100 messages from people saying that they were praying for me and hoping for a speedy recovery. And I could definitely feel those prayers, because the day before I was feeling super anxious, and I found myself almost like nesting, trying to like just keep myself super distracted and like picking up stuff and cleaning the house. And that morning I woke up with like a total sense of peace. Even like when you lay down on the surgery table and you're looking up at these, it's a very sterile room, and you're looking up at these lights and stuff like that. And you're just kind of like, oh my gosh, here it is. I just had this total sense of calm come over me, which I would say is not normal for me when in those circumstances. But they went in and they did a tummy tuck. They were able to, the reason that I'm really sore is because they did stitch the muscles back together. And he said a lot of times if it's not too much of a separation, then he won't do it unless he finds that it's going to give you a flatter result. But there was enough separation in there that he felt like it was necessary. They were also able to, there was a hernia around my belly button. So they were able to reattach that rather than making a new one. And they also then did lipo on like the sides of my, each side on my hips, and then a little bit on like onto my back a little bit. And so he essentially was telling me that after the fact that you're going to be more sore from the lipo than you will from the actual skin removal. So
I wonder why that is.
I think it's because of all of maybe the nerve endings that's affecting.
That makes sense.
I mean, it definitely looked like I've been beat with a bat. Like it's
super bruised.
Yeah. It's gross.
It also is gross.
My drain tubes.
Yes.
Whitney doesn't like to sit next to me. I have them covered as best as I possibly can.
I just can't look at them. I mean, honestly, it's like your juices, like collecting. Your inner juices are collecting in these like balloons.
But they pump you with so much fluid that a lot of it is just that coming back out. But there is blood as well.
So gross.
So, but they took off almost 3 pounds of skin, and like the equivalent of about, I mean, it's not like an exact, but about 5 pounds of weight in lipo. And, but he was saying it'll take several days before you'll start noticing that, because you're so swollen, and until this, the swollenness, swelling, thank you, starts coming down, you won't really see a huge difference on the scale. But where you'll see the biggest difference is the contouring that they did with the lipo. So anyway, I got home Thursday afternoon about 4:30, spent like 2 hours in recovery. But the pain has been super manageable. They did put me on Norco for it, and it has, like, the getting up has definitely been the worst of any piece of it. But each day has gotten a little bit better. I've been able to do more each day. I do feel like lightheaded a lot of times. I felt nauseous, haven't had like much of an appetite whatsoever. And the biggest thing that I've noticed here in the last day or two is that when I came home, they put a binder on me just to keep everything like compressed. And when they had me take the binder off, it felt like the binder was still on. So it just feels like the skin is super, super tight. And that is kind of like a hot searing, not even so much pain. Is it just like a hot searing feeling? And so it's just a weird sensation, because all of your nerves are trying to like wake up and
wake back up,
readjust. And the most annoying piece of the whole thing is just having the drains in. I have drains in at least at a minimum until Friday. I'm hoping that they will take them out then, but they did originally tell me 2 to 3 weeks. So we'll see.
How long is your scar? It goes from like hip to hip, right?
It does go from hip
so
to
it's
hip.
Bigger than a normal C-section scar.
Correct. They went in along my C-section line.
Okay, so it's
scar line.
as low as a C-section line. Okay.
But what's weird about it is that I don't know if it's just because I'm not used to seeing anything over the C-section line. It feels like it's higher, but there's not a second line. So it's like they went in through the C-section line, but everything feels like it's been pulled up a little bit.
Oh, interesting.
So yeah, it's kind of interesting because my line here ends on my actual hips, which feels like it's higher than where it was
Maybe
before.
when they pull the skin down and they stitch it together, it did lift it a little bit.
I wouldn't be as surprised because they do. I mean, they took out, they resected a ton of skin.
Yeah.
So I'm sure some of it does come up.
Interesting.
Might have to change the way I shave a little bit.
You might have to wear like higher waisted panties or something.
Oh. So, but honestly, overall, like I would say the only thing that's getting old is having the drains in because I don't feel like I can sleep on my side.
How long are you going to have those drains in?
At a minimum 1 week, a maximum 4 weeks. It really just depends on how long it takes to, like, if they stop draining, like if I were to go multiple days with nothing, then I think they would come out sooner than later.
Interesting. So, did they staple you together or?
No, I asked that question and he laughed and said if he stapled me, they'd take away his union card. So apparently they don't do that anymore.
Oh, really?
So it's all dissolvable stitches.
They stapled me for my first 2 C-sections.
Okay. Well,
and I had to go in and have the staples removed, and it was not a fun feeling.
Yeah, I definitely had staples for something else. I can't remember what. And he was like, no, we don't do that anymore.
Really?
So it's like layers and layers of dissolvable stitches.
Really? That's interesting. What's funny though about my first 2 C-sections, not to make this about me, but with my first 2 C-sections being staples, I had another doctor for my 3rd C-section, and he was like, you have very, very minimal scar tissue in there. It like healed really well. Yeah.
So he actually told me the same thing when I went in for my consultation. He was saying you can't even see your scar line from your C-section. So he was confident that it would heal very well for the tummy tuck as well.
Yeah. Like I wonder how visible that scar will be later on.
Yeah. And it'll be interesting because what I haven't, I've been wearing all my pants below my waistline because of the drains. So I haven't quite figured out like how high up it'll be on like a pant line and stuff too. But
it's fascinating.
Yes. But I'm also, that wasn't my first plastic surgery that I've had. So, it wasn't my first rodeo, I guess I could say, because I did have a breast augmentation back when I was 21. And then I had one of them deflate. So I went back in when I was 23 and had them redone. And I also had lipo done in the past on my legs and my butt. So I definitely am one that I just feel like if you feel like it's going to make you more comfortable in your own skin, then you should do what's going to make you feel best and not be, it's kind of like the miscarriage talk, right? Like I don't think you should have to feel like you can't talk about it or that it's a shameful conversation.
Yeah. And who are we to pass judgment on someone else for a decision they made about their own body?
Yeah.
That's what bothers me. Like, I kind of felt like, so I did lip injections and, my husband wasn't a big fan of it. And I was like, you know what? This isn't your mouth. Like I've had to live with no upper lip for a really long time. And it bothers me when I see my smile and it's super gummy. And like, I don't do lip injections anymore. I could probably still benefit from another one, but, my upper lip is still full enough that when I smile, you're not seeing my upper gums. And I'm like, that was all I wanted, And it's like, if you want to do something minimal or maximum, like whatever, like, and it makes you feel comfortable and you have the means and I feel like do what makes you feel like comfortable.
Yeah.
Because life's too short to sit and like feel uncomfortable in your body.
Yeah. Well, and I will say too, depending on the office you go to, they did also have financing options, and I'm not, like saying that that's the best way to go for plastic surgery.
Well, but I charge it on your credit card.
I do think that there is a lot of times people feel like it's way too expensive to be able to do. And if it is something that you want to do and you could make it more manageable with a monthly payment, that is an option. And
yeah. I mean, I would be willing to do that because I've had 3 C-sections and I definitely have like that curtain of skin, and like a lot of my tummy is just full stretch marks and saggy skin. So I would do that if I could, but I don't have the means right now. So financing would be like a nice option.
Yeah.
Just have to get Isaac on board, which who wouldn't be, but I'll work on him.
Yes. So overall, the surgery went really well. I'm supposed to have a follow-up appointment on Friday. And then they said after, the pain would be at its peak at like the 48-hour mark. And then it would start to, taper off, and that I could, return to light activity, like walking to the mailbox, going up and down a flight of stairs within 2 days. But I just can't I can't lift anything over 10 pounds for 4 weeks. So I can't lift Briggs and I can't work out for 6. So they basically full recovery is kind of like C-section recovery would be like 6 to 8 weeks. But I don't think I'd want to anyway.
Since you've had a pregnancy, like a vaginal birth and a C-section, and now this, how would you say the recovery is compared to those?
So the vaginal birth was a breeze in comparison to everything else. I was in the best shape that I could have been for Brecken, and I bounced back, I would say, in a week or less. Like, felt fine, no issues. Briley hadn't been working out at all, had miscarried in between her and Brecken, and I hadn't been working out and didn't work out through her entire pregnancy. And I definitely paid for it afterwards.
She was a vaginal birth?
She was vaginal. And I just felt like it took me a lot longer to get back. It was 2-3 weeks before I was still feeling really wore out. Britain, I was working out again. I felt like that was a pretty easy recovery, but each pregnancy, you're also older. C-section was like nothing else. It was nothing like vaginal. Because you just are so sore. And now because you cut through your abdominal muscles, your back is taking the brunt of everything. So not only are you walking hunched over, your back is sore, and you've spent the last 9 months with your back being sore. And now your back's taking all this extra, hit from the stomach.
Yeah. It's even worse too when you're breastfeeding because your boobs are so heavy. Like your back is sore, and then it's not a fun experience.
Yeah. So that one, I definitely felt like took me a good 3 to 4 weeks. At a minimum, to just kind of feel like I felt really lightheaded. I felt really tired. I felt really wore out. And this, I would say, is in the realm of C-section. I would say it's more painful than C-section from the standpoint that it's covering more area, but less, but I would say pain wise, it's probably about the same.
Okay.
So
good to know.
Yeah.
I know a lot of people are probably wondering how much this costs. Now, with that being said, it also depends on your area.
Yeah.
Because I know like a tummy tuck and like a breast lift or whatever.
Yeah.
Those would cost way more on like in California or in big cities.
I think it completely depends too on, who you're going to. I don't know. I'll just say that it was for sure over $8,000, but I think it varies completely depending on what you're having done, and who's doing it and where you live. Yeah. So, but yeah,
sure.
It's definitely not a cheap procedure.
So you mentioned you had done liposuction a while ago. Would you suggest doing it again? And a breast augmentation?
Would I suggest it to someone else?
Would you do it again?
You mean if I needed it again?
Like, was it worth it?
Oh, I see what you're saying.
Sorry.
Like if I could do it all over again.
I worded that really terribly.
I definitely would. I felt like the liposuction, anytime that I have gained weight, it has never come back in the same way that it had where the lipo was taken off. So it definitely changed my overall appearance and shape. Yeah. And so I definitely thought that lipo was honestly very easy recovery. For me, it felt like I'd worked out really hard. I had to wear like some compression garments for several weeks afterwards, but it was not a hard recovery at all. Breast augmentation I did when I was like 21. It was, something that I did before kids. And so when I was extremely, extremely insecure about my chest, I felt like wasn't proportionate to the rest of my body. I didn't want it to be like, oh my gosh, what does she have done? I wanted it to look very natural and just look like that's what I should have had.
You were, and I don't mean this to be like mean, but I remember you being extremely flat chested.
Oh yeah.
Like I think I was bigger than you and I was like 6 years younger.
I was going from like barely an A cup to just going to like a small C is what I was wanting to do. I always wore padded bras. Then I had to find padded swimsuits. It was just something that it was like a huge insecurity for me.
Yeah.
And even to this day, honestly, I think that if I didn't have them, I still wouldn't be very large on my own, even being older and heavier. And so that recovery, the first one was extremely hard because your skin is stretching.
Yeah.
And I've heard a lot of people say that it's a lot easier post children because your skin is stretched out from, nursing and or your milk supply coming in. And so that it would probably be different. But that was I just remember feeling like I had a elephant sitting on my chest and it was super painful. So that recovery was really hard. And, but when I had to go in for the reconstruction or the deflation, that was like a breeze. I think it's because my skin was already stretched out and I was back at it within 5 days or less. And so that was no big deal. But the first one was pretty tough.
So it's more about like how much your body is changing.
Yes.
So like obviously going from like an A cup to a C cup is going to be pretty painful. But if you are like a deflated C cup,
Yeah.
like me, going in and getting a little lift won't do much.
No, I don't think it would be that big of a deal because your skin's already stretched. Because I had several friends that after they knew I had done it, decided to go and get one. But they had both had kids and their recovery was nothing like mine. I mean, like days, they were fine.
Man.
But then other people who didn't breastfeed, didn't have kids and had done it afterwards had the same experience where, especially if they were going to a larger cup size, felt that same like stretching. So I would never say I would recommend it to people, but if I was doing it again for myself, it was something that was a confidence booster for me and made me feel more comfortable in my own skin that I don't regret doing it at all.
And you did saline, right?
I did do saline
instead of the silicone.
both times.
Yeah. So you had gotten your augmentation out in California. Would you mind talking about price range for that?
So, I mean, I had it done back in 2001 and at that time it was around $5,000.
Yeah.
And then they had it set up that you could do an insurance policy on them because the lifetime warranty on them was like 16 years. So if you did have something happen like a deflation, that they would come in and redo it for free.
Wow.
With the only thing you had to pay out of pocket was the anesthesia, which ironically is exactly what happened to me. And so when I went back and had it redone 2 or 3 years later, that was the only thing I had to pay for. So I would highly recommend if you do it to do the insurance policy for sure. Because in my case, it was worth it. But to the point that actually mine are now to a point that the lifetime span on them is over. And I have thought like, maybe I would
get them redone.
Yeah. Go in and
oh
have
my
them
gosh.
redone.
Have you heard of people getting like fat transplanted? I feel like I would be more prone to wanting my own fat transplanted into my chest.
I never understand how that works because why would it not just dissolve?
Yeah, I know. I don't know how it works, but I would be just more prone to that instead of introducing my body to something foreign. Because in my case, for as sensitive as my skin is, I know my body would be like, nope, I'm rejecting this breast augmentation. And so like, it can't reject its own self, I feel like that would be what I'd be more prone to do.
I do know several people that have gone in and done lifts post baby and have had great results and are super happy with it as well. So I think anytime that you're doing something that like just literally makes you feel more like you are reclaiming your body post kids, I feel like you're going to feel different, even if it's not necessarily like they may not be perky like when you were 21, but you're going to, not having pointing directly to the floor.
Yeah, mine don't point directly to the floor, but they're definitely not where they were. I breastfed 2 children, 2 out of the 3. The first one I should have, but I was thinking it'd probably be better to formula feed because I was working full time. But they are definitely a little lower, and I would like them to be up here,
the bulk of them.
Because oftentimes I feel like I'm like going like this, like holding them up, and I'm like, that's not attractive. Like
that's one thing that I've been grateful for with implants is that post kids, they still have kept their shape and relatively remained in place. Like, I mean,
there's no reason not to have been,
But I just mean as a whole, like, they have sagged a little bit, age, it's natural, but that is one thing that I've been appreciative for them.
Yeah.
Is that they have looked relatively similar to when I had them done.
One thing, so I follow Kim Kardashian's plastic surgeons. She has a few naturally. And she still claims that she hasn't had plastic surgery. That bothers me. I'm like, just come out and say it. I mean,
why not be honest at this point?
Yeah. I mean, she's so much in the public eye that I get it. I get wanting to like keep some stuff private, but it's almost like she's lying about it. And I'm like, I know you've had your nose done. That's fine. Like, just explain it so other people that are in that position that want to have their nose done know who to go to.
I think again, celebrities have every right to privacy, but what I feel like is that you're giving off a false sense of beauty because you're telling people that this is my natural, and it's not. The reality is that 99% of the time you are photoshopped or
filler.
if we are seeing your natural, it's been enhanced by other things. And I just,
let us know. I want to know what enhanced. But anyways, what I was going to say about that is Dr. Simon something. He has Epion. It's like his practice. They do this thing where it's like cool sculpting, and they also do like a laser for stretch marks. And I'm like, okay, who do I go to near here that does that? Because I have so many stretch marks that I'm wondering, one, if it would cost as much as a tummy tuck, or two, if I could get away with doing a few things like that to improve the look of my skin, my belly skin, and like tighten it up. Because, but however, mine's pretty severe, so I don't know if it could work. But that's one thing where I want to know my options. You know, I dive headfirst into a tummy tuck that could cost me upwards of $8,000 or whatever it is, or can I do like a med spa where they just like do micro needling? Well, I've heard that one doesn't work as well, but where they do like a cool sculpt laser and could improve the look of my skin and also like the tightness.
I mean, there's all kinds of options out there. And I think if you're looking for things that are, you know, that don't have the plastic surgeon price tag, there are definitely alternatives for sure.
We should,
I don't know what they are, but we should find out.
Yeah. I was going to say, we should like go track down someone local and be like, hey, give us our options. I want to know.
Well, cause even, you know, Landon, who we follow, she has gone to someone who does all kinds of laser treatments for skin, hair, all kinds of things.
Laser treatments for hair?
Like hair removal.
Oh, I was like, what?
Yeah.
Oh, I would love to do laser hair removal on my chin.
Yes.
Because I feel like I have a few more whiskers, you know?
It does.
It's fun having dark hair. Oh, I heard Claudia Oshry talk about this. She's like, everybody talks about how like beautiful and thick and silky my hair is. And she's like, she said, the texture and the look of my hair also is in my armpits and my legs. She's like, so just to like forewarn you, yes, I do have beautiful hair on my head, but I also have that elsewhere.
Yeah, it's true.
I'm like, yeah, I feel that with dark brown hair.
The curse of thick hair.
Yeah.
Any other questions for me while we're on the topic of
shoot, what are some questions that people had asked you that we haven't covered yet?
Honestly, I think we've touched on them. The main ones were just like the cost, what finally got me decided to do it. Like what kind of pushed me over the edge. And I think the reality of it is that when I started doing 75 hard, I felt like I was finally back to a place of like reclaiming me. Like I had, you know, you're in mom mode, you're in boss mode, you're in wife mode, and you kind of, there's pieces of you that you start losing yourself. And when I started doing 75 hard, it was the first thing I'd done that truly was just solely for me. Weight loss, like reclaiming like my emotional health, my physical health, all of those things. And that was kind of when I decided I'm like, you know, I'm going to go ahead and take the plunge because there's always going to be something else that you can spend the money on. So I'm not saying it's the greatest use of funds, but I felt like this was like that one thing that I wanted to be able to do for me and be able to do, like I said, post kids, that brought me back to what I felt like is a state of physically whole.
Yeah, I feel that. And I feel like too, I mean, mom guilt could be like a whole episode, but like, say when you're working out, you're going to have mom guilt because the kids don't want you like, or want your attention. And like when I'm in the basement, I do my workout in the basement. My kids usually play around me. But here recently, Ever has been wanting my attention the minute I start my workout. It's like she knows I'm going to be doing my workout. And so then she starts whining and complaining. And I'm like, I start to feel guilty that I'm not available for her. And I'm like, this is like my one time during the day that I really just need for me, because it literally resets my brain and helps me take out the trash, is something we mentioned before.
It makes you a better mom.
Yeah. And it makes me a better mom. And yet here I'm feeling guilty for that because she specifically wants my attention. So when that starts happening, Isaac, my husband Isaac should be like a gold medalist in fathering because he's the best. But as soon as she starts doing that, he knows, he's like, I'll come get her. And like, he knows that I need that time to just be able to knock that out. And then I can be present with the kids. And what's really annoying is if I'm sitting there reading a book, she's totally fine. She's just like playing around me or whatever. But it's like, as soon as I do my workout, it's like one more thing in between me and that time for me. And so anyways, what I was meaning about that is I feel like there's always going to be some guilt factor in it. And you're always going to somehow convince yourself that maybe you're not worth it, or you should be spending this money on something else, or you should be spending this time doing something with your kids or being more intentional. There's always going to be something standing in your way. And I feel like, you should just allow yourself that. I feel like allow yourself that time, because it is important in the long run, because you are going to try to set yourself aside for your kids.
Yeah.
That's just what moms do.
Well, and I think the bottom line of it is, like we were talking about, Kait was saying, once I have my new teeth, the reality of it is nothing's going to like totally satisfy or fulfill you.
Yeah.
Right. It doesn't have anything to do with like, all of a sudden now that I have this, everything's going to be better or change or different or great. It's just something that you're doing for you.
Yeah.
Like, I get that my fulfillment doesn't come from a tummy tuck.
Well, yeah.
I understand that my purpose and happiness is not going to be completely fulfilled with that surgery. But I do think there is something to be said for being able to take opportunities for just you.
Yeah. And show up for yourself.
Yeah.
Because you also need to be taken care of.
Yeah.
By your own attention, like if you are avoiding certain feelings or avoiding certain things, that your body is like, hey, pay attention to me, and you're focusing mainly on your kids, like that can wreak havoc too, and can also bleed onto your children. There's generational things that you can be like, I need to take care of this now, so I'm not extending this onto my family.
Yeah, for sure. Well, that is another episode of the Sisterhood Society podcast. We appreciate you guys joining us today and talking all things plastic surgery. If you have liked this episode, or if you want to leave us a review, you can do that in Apple Podcasts.
Or if you work at a med spa and want to talk to us, we would love to have you on the show.
We'd love to have more information.
I want to know all there is to know about
non-surgical procedures.
Yes, let's hear them.
So join us next week when we it might be our book club week.
Oh yeah, I need to read that book.
Yes.
What was the book? The
Murder Club Mystery.
The Thursday Murder Mystery Club.
Something like that. Yeah.
So go check that out if you want to participate. I haven't read it, so you can read it with me this week. And Tara, apparently.
Yes, I need to listen to the Audible.
Yes.
So we will be back next week. Thanks for joining us, guys.
Bye.
Bye.